What makes you so unique? Conversations with Nicole. Conversations with Nicole. Conversations with Nicole. Conversations with Nicole.
Greetings, good evening, happy Wednesday. It is Wednesday, July 22nd, 2020, and it's what I call What Women Want Wednesday. I am Nicole Everett, the host of Conversations with Nicole, a talk show based here in Tallahassee, Florida, focused on connecting the community through conversations. So What Women Want Wednesday is an opportunity for the women, the sister, and the ladies to converse with me and my guests about a topic or several topics. So I invite you to do so. We will take your comments and questions about the topic as we get going. But before we get started, before I introduce my guests, before we talk about the topics, I want to know who's with us tonight. Who's with us? So let me know in the comments. Put the city and the state that you are tuning in from. Let me know. Let us know where you are tuning in from. And please go ahead and like and share this. We have been covering mental health practitioners all month long. July is Minority Mental Health Awareness Month, and we have had Black and Brown counselors and therapists all month long in an effort to dispel some of the myths and eliminate the stigma around mental illness and the need for mental health services. So that's what we're doing. We have two dynamic ladies with us tonight who I can't wait to introduce to you. So I see you, Felicia. She said here in Tallahassee. Appreciate you being on. So let me know, what city and state are you tuning in from? Put it in the comments. And please, by all means, if you have any questions along the way or any comments along the way, by all means, put them in the comment box. I see you, Sharon. Greetings from Winter Haven. And Miss Stephanie Bowden here in Tallahassee. Thanks for tuning in. I appreciate that. So like I said, July is Minority Mental Health Awareness Month. And we have, again, like I said, two dynamic speakers tonight. So Dr. Michelle Mitcham, many of you may know her. She's here in Tallahassee. I'm not going to introduce her, but she's here. And then Miss Jovasha Lang of Lang Consulting and Counseling. She's going to tell you about herself too. So welcome, ladies. Yay! All right, so Dr. Mitcham, if you will, you've been on Conversations with Nicole before, just a different format, but tell the folks who may not know you where you're from, what you do, who you are.
I'm Dr. Michelle Mitcham. I'm here in Tallahassee, Florida, originally from Detroit, Michigan, and I am a licensed mental health counselor, a national certified counselor, and a whole bunch of other credentials you don't need to know. But anyway, I'm also a professor, and I'm associate professor at Florida Agricultural and Mechanical University. In our counseling program, we have clinical mental health counseling and school counseling, one of the best kept secrets at Florida A&M. So I'm very happy to be a part of the Florida A&M family. I have a business called Courageous Conversation, where I do psychotherapy. I'm also the owner of Tallahassee Woman magazine.
Okay, thank you very much.
Thank you.
And Ms. Lang.
Hi, I'm Jovasha Lang, and I am the owner and executive director of Lang Counseling and Consulting Group. And we provide services in the Big Bend region. So we also provide services in the rural counties as well. I think that's important to note because there's not a lot of opportunities for therapeutic services. I'm trained in a modality of treatments along with my other therapists, and we're just here in Tallahassee affecting change and trying to be broader with our perspectives. I'm also licensed in Georgia, so I do some work in Georgia. In the field of mental health and counseling, and I do a lot of work in child parent psychotherapy.
And where are you from?
I'm from Tallahassee.
Okay. All right. So Tallahassee representing. Very good. So tonight we are going to dive into the topic of unlocking awareness and securing emotional safety. Unlocking awareness and securing emotional safety. So unlocking awareness. Me and Dr. Mitcham have been talking about this topic before, a few weeks before this broadcast. So I'm gonna call on her to kind of get us going on that one.
Okay, so when we think about unlocking awareness, a lot of times Nicole, we're talking about was, just people's awareness of their issues. And so what I've learned in, doing this for so many years, I hate to say, I think I graduated in 1999 and being a professor since 2005, and even teaching students, is that the awareness piece, when you have to meet people where they are. And so there's that awareness component, there's knowledge, and then there are skills. And everybody's at a different place with their awareness. And sometimes awareness is totally buried and there is no awareness. People may have some emotional memory from something, or they have a feeling and they have triggers, but they have no idea where they come from. So their awareness is not even in the forefront, it's under the iceberg. When you think about that whole analogy of the iceberg, you only see what's kind of on top, and there's so much, as Javasha, I'm sure, would agree, on the bottom, and they don't even have the awareness. They might not be cognizant that there is a problem. They think
Right.
everybody else is the problem, everybody else around them, but it's not them. And so clinical mental health counseling, psychotherapy, and all of these different modalities help to unlock and raise awareness and bring to the forefront some things that could be very painful, very uncomfortable, but it could change a person's life. And so that's where I just go back to that awareness piece, that there's so many people that aren't even aware. And so by different tools we use in the counseling field, it helps to unlock the awareness or increase the awareness. And that's a starting point to even acknowledge. Just like when you think about people that have an alcoholic problem or a drug problem, the number one thing first, they have to acknowledge that there is a problem. Right? Most of the time they don't think, they're like, when everybody else is having one drink and they're on drink number 5 and everybody else is uncomfortable. Everybody's on their second drink and they're on drink number 6 or 7 and everybody's cringing like, "Ooh, what are they doing?" And you know that they're probably a functional alcoholic, but as friends, you don't even know what to do. Like, "Whoa, what do we do? This person has a problem," but they're not even aware.
Okay. Wow. So when I what I'm hearing you say is the first part of it is an acknowledgement, right? So understanding, and I guess I see that as more of a so self-awareness, but really being in tune kind of with who you are, right?
Yes, it's as being in tune with who you are, but there's certain things we just don't even know because we haven't unlocked it and we don't, there's no awareness. I do a lot of counseling with couples as well as a Gottman trained therapist. And it's amazing the things that couples bring into a relationship, and they think that they have a problem with their spouse and they have these triggers and they just keep reacting and reacting and reacting. And really, there's an invisible person in the room. They sometimes have unfinished business with their family of origin, and they're really trying to play that out because they never got the end of the story. And so unconsciously, they recreate the drama in their current relationship, and they don't even realize that they're still suffering. So it's almost like if I'm right here and I'm fully aware and I see you, I see everybody here, in this Zoom phone call, and I'm here and I'm present. But sometimes they're really not present because of a pain from 5 years ago or 10 years ago or 20 years ago. So it's like if you're in front of me and I'm trying to relate to you and talk to you, there's something blocking. For example, take their trauma or take that pain that's unresolved, and it's like this or like this. You know what I mean? So it's like you're just, a part of you is there and there's this other piece. And so many times they don't even realize that they're bringing in the unfinished business from their family of origin or some past relationship into their current relationship, but they're not even aware until they go into some type of treatment plan and have some of these interventions to unlock this awareness and then gain insight. And that's one of the things we do as therapists. We want to see, where's your insight? And so sometimes the insight is at a very low level when they first come to counseling, or sometimes they say, I have a problem, I have no idea where it comes from. And oftentimes they think they came in for one thing And after doing extensive therapy, we uncover, right? We uncover things that are in that blind spot.
So one of the things that we talked about on my show on Monday was getting more minorities through counseling. I think that that's, probably one of the number one things is, getting us to not have the stigma, not, be talking about, you know, the religion is going to save us. And not that that's not the case, but, you know, God gave us therapists and counselors as well. So all of whatever hangups we have, I know there's some distrust also with the medical community, oftentimes with Black and brown folks because of some of the okie that has gone on with us from Tuskegee. It's not Tuskegee. The Tuskegee experiment and other things. We have been part of being guinea pigs for the health community. So there is some distrust there. So I think getting us to the therapist, getting us to the doctor, the psychologist, or what have you, that's the biggest thing. And then, I think sometimes we can also be in denial about what we're doing, that may be detrimental to our health or, to our relationship with our family members and whatnot. So how would you overcome that? How do you help someone to overcome that need to unlock their awareness?
Oh, that's an excellent question. So one of the things when you and I had talked the other day, we were talking about just different tools because there's so many levels to that. You talked about the stigma, the taboo, and unfortunately, the our field of psychology and counseling actually perpetuated that stigma because of studies and because of, studies that were wrong, right?
Mhm.
With saying that, Black people weren't as smart as white people, all kinds of racist studies that were not based really on research that were perpetuated in the counseling field. And so we're trying to recover from that, right?
Mhm.
And then again, what you said, if you are have a theoretical orientation, or depending on your religiosity and the way that you were raised, you may think that no, we don't go to a counselor. You go to your parents, you go to your auntie, your uncle, you go to the preacher, you go to maybe, depending on what country you're from, there are many different beliefs of who you go to. Could be some other spiritual person or it
Mhm.
could be an energy person. And
Right.
so just the taboo of what people have this fear of the unknown. So they have a fear of what they think a therapist does, and they really don't understand the process of
Mhm.
going through therapy. So in a process like I use many different modalities like the Gottman couples counseling, cognitive behavioral, and many other things, person centered. So if people have that trust, like you're saying, they have to trust, you have to build rapport with a patient. And when they come to you after talking to them and finding out why they're there, and once you have the trust, you can actually then use different interventions. And so there are many things that I use, many things to unlock. We already know about journaling. So people are journaling. Sometimes we ask a patient to, write a letter to their parent. Maybe they have all this pain and hurt inside, and they've never been able to have a voice. There's the empty chair. There's all those kinds of things. And so they write a letter to that parent. Maybe they never mail it, but they write down all their feelings, their hurt, their pain, their regrets. They write down all the things they wish their parent would have said to them, and they may or may not mail the letter. They also, in addition to journaling, there's like a cognitive thought record, and that's another tool, just a technique where they kind of deconstruct their thoughts about something, and maybe it's an irrational thought, and then
Mhm.
discuss the feelings that they have, the triggers, and then they talk about all the proof that's in their life to support that belief. And we talk about that, and it's really a process. It's not just one session, it goes on.
Right.
And typically, I've seen that people have really made a great change when they have committed to therapy for about 3 months. That's what it takes. Because if it takes, say, 15 or 20 years to get to a point, right, where there's a problem, it's not going to be turned around in one session in 1 hour.
Right.
And that's the part that what happens is it ends up, it's almost like this sounds disgusting, but people have to throw up before they feel better. And so
Mhm.
sometimes it gets worse before it gets better because these feelings do come up and people wonder, how did I get here? I'm smart. I'm educated. How did I not know how to handle this problem. Or, wow, I didn't know what counseling was about. Why didn't I come before? If I had come to see you 5 years ago, I wouldn't be in this predicament. But again, it's awareness, like you said, Nicole. At what point does something happen in their life that increases their awareness or puts them, some people have been in abusive relationships. They feel the pain, when the pain of holding on becomes greater than the pain of letting go, you will let go. And so sometimes people have to crash, right? And they have to crash, and there's some crisis before they end up seeking help because they've tried everything, exhausted, praying. And of course, I'm not saying to stop praying, but sometimes you need some structure and some interventions to go along with that. You have prayer, you have your professionals, you have everything else. You might need some psychotropic medication, maybe some self-care, and there's a lot that goes into healing. And that healing process is really, really tough because we peel back the layers of the onion with all of these different tools and interventions, and sometimes guided imagery and other things to practice mindfulness to get them in the space where they understand.
Okay. No, so I was actually going to mention about how, maybe sometimes they of course don't realize it. Again, it's either there's something that happens. You said like some type of crisis that happens that brings them to a point of now they're really trying to understand what's going on, and that may be part of the unlocking the awareness, right? Because of this crisis, this catastrophic thing that occurred in their life that they are, trying to get a handle on, a grip on. So now they're seeking some professional help. So, Jovasha, I don't want this to just be Dr. Mitcham, even though I know I said I was going to call on her. So, I see you nodding every now and again. So, if there's a point that you want to make, by all means, to jump in.
Oh, yeah, definitely. And I think that what Dr. Mitcham said is very key. And I think that for me, the starting point is validation. So we validate what people have been using before they got to us, right? So if it's prayer, if it's self-care, if it's exercise, if it's another form of an outlet. So we want to validate that. And there's positive validation. There's validation to say that's probably not the best method, but we want to validate and then talk about what's realistic and what are reliable things that you can start to incorporate into your toolbox to make that change, because we know change is a process. And so we can't, like Dr. Mitcham said, you can't do away with the things that a person has ingrained in them, but we can add to that, and we can also help them see the value in what part of change is positive and what part of things what things they need to let go. Because we know that's a hard process. And definitely in the African American community and in the minority community, therapy is still taboo, and therapy is still something that is perceived to be wrong. Sometimes you don't have to come to therapy because you hit a crashing point or because there's trauma. With the pandemic, a lot of people are having time to sit in their own thoughts and think and process when they haven't before, because we've had work or social gatherings or other things that fill that empty space. But time is a big predictor. When you have silence, when you have silent moments, when you have time to spend, then you think back to the things that maybe these things weren't organic, or they shouldn't have happened, or they weren't natural, and this is trauma, even if they don't classify it as such. So I think even just having that moment of still time, there's those words that we haven't spoken yet, but we know that our own internal voice is the loudest voice, and being able to recognize how do we move forward.
Wow. Yeah. You said a mouthful there. Look, I'm writing my notes right now for both of you. Really, really great points. And yes, I think that, especially with the pandemic, especially with what's been going on with the social unrest, people are grappling with a lot of thoughts and maybe some memories of, times past or past experiences that have maybe not been resolved, maybe not been processed, maybe, they're still trying to heal from. So it's a lot to consider. So, I still want to kind of focus on unlocking awareness just a little bit more, because I think sometimes we can not be self-aware due to, as maybe even a defense mechanism or a protector or coping mechanism, because who maybe we truly are, maybe we feel like there's danger there, it's not a safe space, or it doesn't meet the approval of whoever we might be interacting with. So, I just wanted to kind of touch on that a little bit if either one of you want to speak to that.
Yeah, I would say that, the awareness piece, maybe many people again they're not aware. They're not aware, right? They're just not aware. And so it's one thing, yes, to when you first engage with a patient or a client, it is important to validate their feelings and all of that. That's one of the first things you do, build rapport and you validate and all of that, because you want people to know it takes a lot of courage to ask for help, and you have to have courageous conversations. And so I always commend people for asking for help. But oftentimes, what they initially ask for and what comes out in this unraveling process of really unlocking what's inside, they're shocked when they peel back the layers of the onion. We get down to that iceberg.
Mm-hmm.
They thought that they were coming in for one thing, and they realized it was all this other stuff.
Mm-hmm.
So, for example, there could be dysfunction in the family. There's so many families that we just can't assume. Like, I came from a family where my mother said, "I love you," and gave me a hug and gave me a kiss every day. She was always saying, "I love you. I love you. I believe in you." And that was amazing just to have that. Some people have never had another human being say, "I love you," and had a hug. Some of them have had lots of trauma, or they've been through foster care and foster homes, and they just, remember the movie Antoine Fisher? You remember that? With
Mm-hmm.
Denzel? That was a great movie. That is so textbook, because there are people that have had these things and they've overcome. They're successful and they're doing great, and they've measured success by their good job. I'm making money. I have a home. I have my 3 children. I have the whatever, the 5 cars in the fence or whatever.
Right.
And they think I'm successful, but inside they have some turmoil and they don't know, and they think it's one thing, or they think I have an anger issue. Right? And they come to find out about the anger issue. I had someone, for example, a couple that came to talk about anger, and they thought that they were angry with their spouse. And it turns out that they had never, ever, ever forgiven their father for leaving when they were 5 years old. And they were so angry, and they felt that they were less than, they had low self-esteem.
Wow.
And so there were issues that went all the way back to childhood, and this anger was just so painful to talk about. It's a very hard pill to swallow when you hear other people that have been validated by their parents. They had loving family. And so again, the unlocking comes sometimes after they do present with one problem, and after you showing that you care and having that rapport and going through this process, and it just kind of unfolds. And it really is a beautiful thing, because it increases their self-awareness. It lets them understand, like, wait a minute, I thought that something was wrong with me. And they feel like there's a reason, like, oh, this is why.
Mm-hmm.
And then they end up having the opportunity to have peace with their background and know that they've survived their past and they have the tools to survive, that they are resilient, that they have bounced back, and they haven't embraced all the great things that they're doing. But they think that sometimes that how they thought about themselves when they were younger, and this father leaving and all that, sometimes people think that that's like across their forehead, like I was abandoned, or I was, or I have this disability, or you just think it's like there and everybody knows, and it's a part of who they are. And they've unfortunately internalized some of the negative feelings, and they've made that like define them. But they realize with counseling that they can redefine once they reflect, because after have a counseling session, there's a lot of homework. We give them, again, more things. I love what you said, Jovasha. We give them more tools in their toolbox. They can build more, they can make more. So they have this toolbox, and they're like, wow, I'm responsible for my happiness. I can do this. There's nothing wrong with me, and it makes sense. And then they're empowered, and then they go back and they're a different person, and they just realize that that's a process where they can reflect, they can renew, and they can retool.
Love it.
Absolutely. And I'm sure that Dr. Mitcham uses this as well, the Adverse Childhood Experience questionnaire. And that's a baseline questionnaire that talks about experiences that you've had in your home as a child. And so when we're talking about defining things, because again, violence may have been the norm in your household, so you don't classify or define it as domestic violence. A parent using a substance, that again may have been the norm, so you learn to operate in that. And so we give that questionnaire to help someone identify, what things happened in their childhood, because a lot of those things are unresolved. And as Dr. Mitcham said, people come for one thing, and then when they start to peel back and they start to unlock those other layers, they identify that maybe this is the root cause of what I thought was anger. This is really abandonment. This is fear. And so fear shows up as a defense mechanism. It shows up as a way to keep people at a distance. So those are great tools that individuals can use on their own. But, in therapy, obviously, it is, you get more processing, you get the clinical backing, and you get that additional piece that will help you mirror your life experiences as well as what you thought was the norm. Because we have to also change people's narratives in a positive way, because we want them to understand what domestic violence is, what substance abuse is, what maladaptive treatment is, and how that impacts you. Because a lot of times we're told, within our own family systems and even with our, social systems, well, that happened to you as a child. And so you should be able to move past that and progress. But we know that with research and with clinical studies, what happens in your childhood adversely affects you as an adult. You can't just leave it in the past. And so we have to address those things. So like Dr. Mitcham said, writing the letter to your younger self, writing the letter to your parent, to the individual that you felt, wronged you or hurt you in a way, is a way of identifying that trauma and addressing that adverse experience that you had.
Okay. Awesome. Love it.
Also, that's excellent. And it's true. What's amazing is there are people that will take that survey and that quiz and think, wow, how did I survive?
Right.
And so we are always looking at their strengths, because when you can focus on all the strengths and say, wow, you survived. We've all been through things. We've all been through things. I think I've shared, I won't go into it. And I lost my whole family except for my brother by the time I was 19. And I'm here. And, I went to counseling, and having a lot of loving, kind people in my life really made the difference. You really don't understand how many angels are in your life that you can survive so many things when you look at and come from a space of strength and show people how they are resilient. And through all of those interventions, as we're both discussing, people realize that they do have the tools to survive, and then we give them more tools. But the tools, it's not that you give it to them, but when you interact with them in a session and then they eventually understand and the tool works and they internalize it and make it a part of their repertoire and a part of their new tools in their toolbox, they realize they can redefine that narrative, as you said, and go forward. It's interesting when you said narrative, Jovasha, when you ask somebody, tell me about your journey, tell me about your life. How did you get here? Tell me the story of your life. So really, everyone has a story. And they tell you how they came down this road and arrived. And so you can hear a theme. So what we can do is extrapolate some type of thematic agenda when they're speaking. So sometimes we can hear that this person is saying, basically don't realize it, they're not cognizant, but they might be saying, I'm a victim, I'm a victim, I'm a victim. Sometimes that's what we feel, because as counselors, we listen with our third ear with our heart. So sometimes they're saying, I'm the victim, everybody's after me. And they still feel that way, or it's everybody else's fault and there's no accountability. So we kind of pick up on the theme, and the theme of how they're going through life and seeing the world instead of seeing the other side.
Absolutely.
Okay. Good point. All right. So I just want to do a little station ID right here. For those of you who are just joining us, we are talking with Dr. Michelle Mitcham and Jovasha Lang. It is Minority Mental Health Awareness Month, and I'm featuring Black and Brown clinicians all month long for the month of July. And we're talking about unlocking awareness and about to move on to securing emotional safety. So that topic is one that I have been chatting with Jovasha about. So I'm going to ask you to take the lead on that one.
Absolutely. When we talk about, unlocking the process and dealing with our attachment issues and trauma issues, we have to first be emotionally secure in doing that. And so a lot of times I think that is what the barrier is for people coming to therapy or implementing any type of self-care, because they don't feel emotionally secure. I'm going to again say those words or talk about those themes or those things that have happened that I've never talked about before, and I don't feel secure in doing so. So how do we start to build our own emotional security even before we get to the therapist's office? Because if you're not at least baseline in terms of security to say, I'm ready to open up and be honest and forthcoming and also be receptive to information, you're coming to therapy, which is going to yield very little results, because that is a part that happens as it's a two-pronged process. You start at the baseline, and then the therapist and the clinician help you to process even more. So we look at what that looks like for you. What is your environment like? We definitely start with the environment, and we're not just talking about, your outside environment. We're talking about your internal environment. So that's something as basic as, how are you sleeping? How are you eating? What are you doing to alleviate stress? What are you doing to cope with stress? What are you doing to address the stressors in your life? And who is your go-to, in terms of your support system? Who's in your support system that may not necessarily be a positive support? So we start to look at it from a very baseline level and then gradually add additional things to make an individual feel emotionally secure. And the journaling is a very good technique for doing that. And we again increase that capacity as a person is engaging and they're able to start to unlock those different pieces of themselves.
So what would you say is maybe the number 1, 2, or 3 emotion that prevents folks from going to counseling?
I think it's definitely fear. I think there's fear of judgment. I think there's fear of unlocking things that we haven't spoken about and talked about. I think there's fear of change, because a part of the therapeutic process is to bring about change. And so change is very, it's anxiety ridden. People don't like change. Change, even when it's positive, it fills a person with angst and it creates unknown. So I think fear, I think anxiety, also in the fear of judgment, that judgment piece, that's a first part that we say, we're not here to judge you. We can't judge you. We're here to help you along your process. And I'm grateful and thankful that you allow us to be a part of your narrative now and to help you reach that ideal self. Because that's what everyone is striving for when they come, is to get to their ideal self and to better themselves. But I definitely think those are the barriers to moving forward in therapeutic process. And even before you get to therapy, picking up that phone or making that appointment online, it's the fear in the unknown.
Yeah. So, we're talking about securing emotional safety. I think a lot of times people don't feel like there's a safe place or safe space for them to express themselves. And that has to do with trust. I think that has to do with, like you're saying, the fear of being judged, fear of, not being accepted, that sort of thing. So how do we get to a place where, Black and brown folks can feel like they are safe? I mean, how important is it, for instance, to have a Black and brown clinician? Do you think that there's a perception, or maybe the reality is that maybe it's a safer space with Black and brown clinicians as it relates to Black patients or clients reaching out to them versus white clinicians? Or could it be the referral from a trusted source, a beautician or a barber, a coach or a trainer that says, hey, I know this, therapist that can maybe assist you with these issues or what have you. So give me a little bit of your thoughts around that.
So what I would like, do you want to start, Jovasha, or no?
Oh, no, Dr. Mitcham, you can start.
Okay, so one of the things that you stated so well, like, people do need to feel when they come to counseling that they have that unconditional positive regard. I think that for many people, depending on, we have to meet people where they are with what they're dealing with and their experiences. And so when you think about cultural competencies and multicultural competencies, so I've been teaching that course since 2005. Again, a sign of getting old. But anyway, teaching the multicultural competencies, we have to teach that to counselors. And so what we know is that the counselors who are multiculturally competent meet clients where they are. And so I've seen many people of any race, that if they're multiculturally competent and that they're an advocate and that's that's important to them and they value that and they really do the work. These are therapists and professors. They do the work, and they're very comfortable with difficult dialogue, different races, different sexual orientation, because we have to also talk about intersectionality, because it's not just, of course, Black and white. There's so many different races. What about the brown and Black communities that are also LGBTQ, and their sexual orientation is different, or their socioeconomic level, or many other factors, their religion. Maybe they have no religion. Maybe they feel like people ostracize them because they're Black and they're an atheist. What do you do with that? And so that to meet them where they are with that intersectionality of all those different identities that they might have with their ethnicity, their race, their gender, sexual orientation, and so many other factors. So there are many people who have been calling me right now. They're dealing with anxiety and stress, as you said earlier, when you mentioned because of COVID, and they're looking for a Black or brown therapist, and they're like, I feel comfortable. There are other people I know that are Black or brown, and they feel comfortable because of their surroundings and their friends and how they grew up, that they're comfortable with other races as well, and they have trusting relationships with different races. So it's a very individual thing, but I do think that we need more counselors of color because we are underrepresented in this field. And so I think that people do need that diversity. You want to have choices, and there is a comfort level. But one of the things we do in counseling is there are differences. Sometimes you could be the same color, but what if someone comes in the age of my child or the age of what my mother would have been or whatever? Sometimes there's an age difference.
Yeah.
So sometimes if you're young or you look really young and you have a much older person and they could be the same color, they'll say, honey, how long have you been doing counseling? Where did you go to school? And so they're checking you out like,
Yeah.
Okay, am I talking to a little girl? And I feel like they're saying in their mind, little girl.
What can you tell me? You can't tell me nothing.
Right. What do you know? I mean, look, you're like 2. And it's like, okay. So there are people that are going to question your professionalism. And so, then, even it doesn't matter if they see my CV, they probably think I made it up. But anyway, no, I'll show my CV and my credentials and all these things. And they're still kind of like, so I think that's very important. As even Jovasha said, we have to make them feel very comfortable, validate them, commend them for coming, to let them know that we're just going to use tools to talk about your awareness, to let them know and to try to normalize the process so they don't think that they're a guinea pig, like you're saying, Nicole, like they're going to be in some experiment. And what are you going to do? That you have to talk to them about, informed consent and confidentiality. And, that you don't share this with anyone except for if they're going to hurt themselves or someone else. We have, as mandatory reporters, we have to share that information. So I think that we set the tone and set the environment to help people feel acclimated, and feel comfortable, and also to share with other people and to keep having what you're doing. You're a great advocate. I know you serve on boards and everything, Nicole. You're like a rock star advocate for mental health. So we love that you're doing this because it's putting the word out there to tell people, hey, let's get rid of this taboo and this stigma. Let's reach out. These are people like you and me. They can they can relate. And there are people, believe it or not, that will, if they want to know where you're from. Some people, they have these markers like, I'll trust her. Let me tell you where she's from. And if people say, are you from Tallahassee? I'm like, no, where are you from? I'm actually from Detroit. Oh, you're from Detroit? I said, yes, I'm from the D. Yep, I'm from Detroit. Oh, okay. So that like scores some points,
Right.
You never know what's going to connect with somebody. You just never know. But that building that rapport is very important. And I think telling as many people, advocating as professors, we publish papers. So we're, peer-reviewed papers. Also, we publish things in non-academic journals because who's reading the academic journals? I think it's the FUBU Society, right? I'm not downing my profession or, being a professor, but it's like for us, by us. So when do other people get to read these things, right? So I think it's important to come on shows like this to advocate for what we do, we're just like anybody else.
Okay.
And we're here to help. And we're here to talk to people and help them to get through and to give them tools because they're not alone and to know that there's help out there. And I think another fear is family beliefs. There are people who wanted to come to me when they finally got to me. They said, look, I was telling my husband, or I was telling my mother, I was telling my family that I wanted to come to counseling, and they told me not to do it, that it was a stupid idea. Why are you going to go to a therapist and speak to a stranger and tell your family business? You know how people think, you don't put your dirty, laundry out there or whatever. And they don't realize there's this shame that they've experienced even from their families that they have internalized. And so sometimes just the shame of what they've been through, they don't dare share that with anybody. And then I realize when they end up sharing that stuff with a therapist, that it's not shocking at all. I've heard those stories a million times, and it's not that it's not important. It is important, but there's no shock value to the therapist. There's some very, very, very tough things that I've seen, that I've heard. I'm also used to be a child custody investigator and work with the court. Really, really tough things and horrible things that I've seen. And it's hard to hear these things, but you have to meet people where they are and let them know that they are not alone. So thank you for your advocacy. We need more advocates to let people in the community know that counseling is okay. Counseling is cool. It's a good thing. And if you feel comfortable with someone that looks like you, that's fine. But everyone that looks like you is not for you, and everyone that doesn't look like you is against you.
True.
So I would just say that because you don't know what's going to connect with another person. You have no idea until they come into that space. They might go to 5 different brown or black counselors, and there could be one that they really connect with because of their age or because of some other experience.
Right. Okay.
And validating those preferences, because again, sometimes there's fear that you're going to be perceived as being prejudiced, or you're limiting and saying, no, we want you to have the best possible experience. So if you would like a therapist in a certain age range, if you would like a certain ethnic background, if you would like a certain thing, that's why we have a variety, because we want you to be able to find that. Because absolutely, you're not going to always connect because we have the same color skin. We have different life experiences, so we definitely, understand that, and being able to validate that there's nothing wrong with having a preference.
Absolutely. And, I tell people, do their research. A lot of therapists are on Psychology Today, and they can read their bios and stuff. And that's just a great, and I know you've shared that resource before, Nicole, just to share Psychology Today. And then you click on Find a Therapist, and you click on Tallahassee or whatever city, and you can read all of their bios, and it will show who they are, their background. And it is important. Even when we deal with a black and brown person dealing with a black or brown client or patient, it's important to let them know, look, we may or may not have a lot in common, but I'm here to meet you where you are, and I care, and I'm here. And like you said, at one point there's something, it could be that they, like one time someone called me that was black or brown, and they were looking for someone that knew about reassignment surgery because they were changing their gender. And they asked about my expertise. And I said, that's not my expertise. They were comfortable because they found a brown or black person, but they were looking for that specific expertise. And they said, well, thank you so much for being, letting me know. And I'm like, no, we have to share with you what our areas of expertise are. And so they look for another counselor.
Okay. So let me just share a few comments. Gian Jones, she actually teaches occupational therapy over at the Florida Agricultural and Mechanical University, and she's been a guest on What Women Want Wednesday. She said, we need to work harder to dismantle the stigma of mental health issues in the Black community. I believe we are making a shift in that direction. And then she added, acceptance and vulnerability is one of the first steps of mental and emotional healing. Acceptance and vulnerability. And I think oftentimes vulnerability can be a difficult one, especially for Black folks here in America, because we have been told that we have to be strong. We can't show weakness. We got to be twice as good and work twice as hard. And, to come off as vulnerable, it's like, what's wrong with you? Get it together. Pull your stuff up by your bootstraps.
And what about, and men don't cry? How
Yep.
many times have we heard people and people, you got to be tough. Men don't cry. What's wrong with you? And so
All
we have all these cognitive schemas and these messages that can just paralyze us. And we don't pick up the phone, like you said, to be vulnerable because of all these beliefs.
mm-hmm.
And then there's the misnomer that there has to be a trauma and there has to be a crisis. Sometimes, therapy is for the positive reinforcement. Sometimes it's just a building block to say, I want to work through some things in a confidential and safe environment. So it's not always that there is trauma. People have therapy for very different reasons. So I think that's another part of it, is that it's always viewed as there's something wrong or there's something that needs to be changed. Just like a physical exam, a yearly checkup. Sometimes people come in for checkups to say, I've been through a lot, or I've had a lot of experiences. I've been through therapy in the past, and I just want to kind of check in to see if I'm okay, or I've never done it before, and I want the opportunity to test it out and see what it feels like, because there could be, a job or relocation issue, or changing career paths, or seeking premarital counseling, or wanting to get married. So there's a lot of positive things that people come to therapy for. It's not always a trauma-based and trauma-focused, because I think that's another misnomer, is that there has to be something wrong. There has to be a trauma. There has to be an urgent matter that is causing this, this stress or this pain. There's a lot of different reasons.
Absolutely. Some people that are just like you said, some people are retooling.
Right.
And they're making a change, or they're thinking about making the change in their life. Like you said, maybe career. Maybe they're thinking about, and they're okay with their decision and they're not traumatized, but they're thinking about divorcing, or they're thinking about getting married, or they do have to just talk to someone about maybe time management. Maybe they are at work and they want to be more efficient. Maybe they want to come up with a self-care plan. So there are people that come in just because they kind of want the counselor to be kind of like a coach. And I hate to say life coach. There's so many people out there that kind of scare me to say that they're a life coach, because they really don't have the experience. Like, everybody's a life coach.
Mm-hmm.
There's 18-year-olds walking around like, I'm an expert life coach. And I'm thinking, oh my God, my baby girl is 22 and you're 18. Anyway, I'm sure they can have some experience. But anyway, so there are actually some professional people and counselors that sometimes I put on a coaching hat, because there's some people, as Jovasha is saying, that want to come in because they actually just kind of want some coaching to get through something like a career change, or they're thinking about going back to school. So a lot of people, I've coached a lot of women that say, you know what, I chose you because you have a PhD, and I'm thinking about going back to school, and you've done that.
Yeah.
And I was like, yes. And I also started a second PhD, but I didn't finish. But anyway, but they want to know, how did you do that? And so, or can you help me with these steps? Because people are wondering, why am I going back to school? And I'm getting, some mixed feelings about it, wondering, do I really need to do it? So just life decisions. I know a friend of mine said that she goes to a therapist just to check in. She's, I go to my talk about your feelings doctor just to check in. Just like, like you have some, like, Nicole, like we just had coffee and say, how are you doing? And you just check in. Like they go to check in and say, hey, this is how my life is going. This is how I'm balancing my relationship. And I'm just here to talk about life balance. I think I'm okay. But they just kind of do a check-in to see how they're doing. And they want some feedback from someone, but they want a professional and they want it to be confidential.
So it's very important. When I was doing the CWN medical moment with TMH, and I had different professionals, because we covered diseases or conditions that were more prevalent within the Black community. And each time when we talked about preventive, they talked about diet, exercise, sleep or rest, and they talked about relationships. So your ability to talk to someone, have someone that is a trusted confidant source, somebody that you can relate to, that sort of thing. And I think that's not said enough. I don't think we're hearing that enough, the importance of having that check-in on some type of regular basis, monthly, weekly, daily for some folks, I guess, depending on how much you need. I want to bring up a point that has been brought up about cost of therapy. So Janita says one reason many people may not go to therapy is because of the cost. I've located several therapists, particularly people of color, but many locally do not accept insurance, or the insurance accepted is limited. private pay scale sliding can be costly. So what are y'all's thoughts around that?
That's true. And I know a lot of people do have sliding scales. Like I'm a very small practice and I don't accept insurance. And I have a sliding scale and I will work with people. And not even besides what's on the website, I have worked with people, especially students or people getting out of a relationship that are divorcing or whatever. So I have worked with many people who are just kind of, again, adjusting and doing something, going to the next phase of their life. And really, again, it's not maybe trauma, but they really do need some intervention. So I think that then that's a whole conversation. Insurance, that be on the insurance panels and all of that. Some practices have to be very large and have a full-time person, and then other people just know how to do it. Some people, they've done it so long they can maybe do it faster than others. And for me, because my primary thing, I'm just by myself doing therapy, so I can't take insurance.
Okay.
I definitely think the cost is a prohibitor for a lot of people, and we have to understand that in the climate and the ever-changing pandemic that we're in, and financial instability for some people, that is a accurate thing, and that's a very real thing. There's always a lot of different methods, because you could look for a practice that have registered interns, so they're under the supervision of a licensed clinician that maybe they're in their last 3, 4, 6 months of that piece of their licensure, and they're under supervision. So that could be a reduced cost. Also, there's master's level therapists. Again, that it depends on the complexity of your issues. It depends on how much clinical experience you want the individual to have. But there are a lot of different methods to therapy. It doesn't always have to be individual with a license or a PhD. There's a lot of different structures to therapy, and it just depends, what you're looking for and what price point you're at, and also making sure that they're trained in that modality of treatment that you're looking forward to or looking to get, additional insight into.
Okay. Thank you very much. So another question on the floor from Shanta Haywood said, how does the reframe, God doesn't give you anything you can't handle, keep so many Black and brown people from getting help?
Wow, Dr. Shanta, world leader Dr. Shanta would give us a question like that.
Of course,
that's a great question, because we do hear these things, right, from religion, and you hear these messages, and so you think you have to handle it, and that can really be a prohibitor, right? It can really hold you back from asking for help, because you think, wait a minute, if this is my belief system, this is my religion, and I believe this, why would I go to counseling?
Mm-hmm.
I'm showing a lack of faith, or I'm not showing that I have faith. Yes, that's a real thing. Yes.
Yeah, am I turning my back on God? So I like what you said, Nicole. Like we said, there's your religion, but also, there's some tools that can enhance that. You can have your religion. You also have, right, because we go to different experts, right? If you have a problem with whatever, the dentist, you go to a dentist, right? You still have your religion, right?
Yeah.
And so if you have a problem with just a problem in life or an adjustment, whatever, you can go seek a specialist, an expert, so that you can get some additional help. And that doesn't mean that you are, abandoning your religion. You're just looking for some other tools, again, to put in your toolbox to help you through, like you would do any other issue.
Mm-hmm.
Exactly. And I've had that question posed to me more times than not. And I've said, you are handling it. This is a part of you handling it. So again, we validate that this is another piece of you handling it. Handling does not mean it has to sit with you or stay with you, or that you don't have to treat it. It means that you're looking for a method in which you can improve what's already there. So again, validating and changing that narrative. And a lot of people say, you're right, this is a way I'm handling it. This is a way that I'm moving forward, and I'm using different skills to address it, because you've handled it up until this point. We're here to then say, what else can we do? How else is this impacting you? How can we decrease the impact? How can we improve if it's something positive? So we always, again, validate that you are handling it. That doesn't mean that there's a deficit. You're looking for different ways, because again, if you're ill, you're going to go to the medical doctor. You're handling that illness because the doctor isn't living with you 24/7. The medicine isn't going to cure all things. You're going to do your part. So therapy is just another piece of that part.
Absolutely.
And then some people do feel, wonder like, wow, why didn't I come to therapy before? And they understand the things that we're holding them back. And so basically, as we know, people actually use the tools that they have from the place that they're at, from where they are
Mhm.
at the time, where they are emotionally, psychologically, and whatever. They do the best that they can with the tools that they have until what? Their awareness is raised, or it gets to a point, that they can't take it anymore. And like you're saying, be proactive and be preventative is really the way to go. And I think with shows like this, and we are making improvement, I think, in really talking about and dismantling the taboo and stigma of going to counseling. And we just need more people advocating, talking about it, just to spread the word.
Okay. So let's talk tips, techniques, tools. We've said a whole lot here tonight, but I want to try to just identify a few things as it relates to unlocking awareness. What can people do? What can the ladies do to help with that?
Well, we talked about journaling is one that we talked
So
about
some of the
that.
interventions, right?
And that's a great thing, because sometimes you write in a journal with a date, and what's important to write also in a journal, I think, is your feelings. And so, we can Google the feelings list and come up with, like, there's about 100 feelings on there. When we can increase our feelings vocabulary and embrace it, we can feel that way, because oftentimes people are not given permission, or they think they haven't been given permission to experience a feeling or to have a feeling. And so just to be also, when they're journaling, to write down the feelings, to get to those raw feelings. There's this, in journaling, there's this, if you think about, I'll show you. If you think about a bullseye, and sometimes people journal, this is very messy, but everybody can picture a bullseye. You can actually just draw one, not messy like mine, but you can draw a bullseye. And actually, when you start journaling, you can journal from the outside and say, hey, what if you ask yourself, what's going on? What am I feeling? What is the problem? What's the issue? So you start, it's almost like when somebody say, hey, how you doing? And you're like, oh, I'm fine. Okay, really, you might not, but maybe you're just exchanging. But then you ask people, say, so how's it going? After you talk to them more and more and more and say, tell me more about that. Well, I'm going through a little bit, but it's okay. Oh, well, how are you doing? Well, in the bullseye, if you journal and think that every time you get a little bit deeper, you're getting to the core of the problem, to the center, to the bullseye, and you can actually track. And so sometimes I've had patients go through and they track feelings, one feeling, and they go all the way until they get to the center. And they track the first, like, initial feelings, these secondary feelings, these tertiary feelings, whatever. They keep getting deeper and deeper until there's this awareness that unlocks. They'll say, wow, I didn't know it had all to do. So that was just one exercise, the bullseye, and to get to the core of the problem. And that's another thing they can do actually with their journaling.
All right. So journaling, bullseye, you talked about letters to themselves as a child, to their parents. Anything else?
Yeah, there are a lot of pre-populated journals, because some people say, I don't know where to start. I'm not sure how to write my feelings. So there's a lot of gratitude journals. There's a lot of naming journals, which what Dr. Mitcham is saying, identifying feelings, identifying trauma, identifying the positive things that are happening. So you can use guided journals as well. That's a great start for someone who's really struggling and trying to figure out, how do I begin that process? We also use song. Music is a huge indicator of different emotions and feelings. We connect with songs for a variety of reasons. So I always tell people, let's do a track list. If we did a soundtrack of your life, or we did a soundtrack of a particular period of your life, or the trauma in your life, what would those songs represent? And so writing them down, listening to them, and then journaling alongside what experience that was in your life is another positive tool. Because again, music tells a story. It's a narrative, and sometimes it gives us the words that we don't have.
So so I've actually had my students do that as well, the soundtrack of my life. And so what's nice is what I have people do is first actually do a timeline and write on that timeline from 0 to 5, maybe 6 to 10, and write things that were significant in your life that you can remember, and write up the significant thing that happened and anything you can remember. And we do that first, and then they add on the music if there's music to that part. And sometimes we don't add the music. Sometimes it just gets so deep because they're like, wow, I didn't even remember that. And so what happens is sometimes when they do the timeline alone, they start picking up on a theme and they see why they ended up where they're at right now
Mm-hmm.
in their job or relationship or their mindset. Maybe they have some their self-sabotaging thoughts. Maybe they're a person that puts other people down and they're a saboteur and they don't know why they're so negative. But
Mm-hmm.
sometimes they go through and they look at that timeline and they're like, wow. Also, using Johari's window, Johari''. Another tool. Johari's window talks about your public self, your private self, also parts of yourself that other people might be aware of that you're not. But in Johari's window, the key point is the fourth quadrant. And that is the blind spot, the part that you don't know about yourself and nobody else knows about you. But through these tools and techniques, you can unlock. It's almost like in a scary movie, right? You think I don't like scary movies anymore. When I was younger, I loved them, but now I don't. But then the scary movies, it's always like that door, don't open that door, don't open that door. What's behind that door? Well, you think just like in a scary movie, like, oh my God, don't open the door. So when
Right.
you open that Johari's window through intervention, through timelines, soundtrack of my life, guided imagery. You can go to YouTube and type in guided imagery and just put in your headphones or have the app. Some of them are free. Guided imagery for anxiety, guided imagery for peace, guided imagery for relaxation or whatever. You listen to the guided imagery, they're 5 or 10 minutes, and it guides you through this relaxation process. They can really get you to the point where you're so calm that you're practicing mindfulness. So, to your point, practicing mindfulness, that's another thing. When do we have a time to be quiet? And you shared earlier today before the show, Nicole, that you practice mindfulness in the middle of the day and stop, gather your thoughts. So, practicing mindfulness, whether that be lighting a candle and just centering yourself, getting some tea or
Yeah.
whatever, your smoothie, and whatever it is. Sometimes there's positive affirmations that we repeat, but if we're in a state of mindfulness and we're appreciating everything in the moment, our feelings, it's a gift to yourself to befriend yourself, to practice mindfulness and self-care, and to get in that practice of having your own thoughts so that you can meditate. That's very important.
Yes.
So there are many things, but Johari's window is just one of many, many tools that you can use to think about what's behind that door. Because when you open that door, then you have demystified, but also you've opened up a lot because there might be work to do when we open up that blind spot, because it's almost like a GPS. If we don't open up that Johari's window, right, that blind spot, then we could be held like hostage for years because we don't know why. We're wondering why we're acting, why is this bothering me? But it's almost like if I say jump in the car right now and drive to California. If you don't have a GPS, I mean, you might be pretty smart, but you take a while to get there. But if you have a GPS and you have the address, you can get there kind of like, wow, I know where I'm going. So once we demystify, right, and there's no more mystique about what's behind the door, at least you can deal with it and move forward and get the answer so you know what you're dealing with.
So I know some of what's been stated for the unlocking awareness, some of that can also be applied to the securing emotional safety. But I also heard when we were talking about the securing emotional safety, that fear was a big factor. So, eliminating the fear, or at least mitigating some of the fear so that you can have enough confidence to go in and, get that initial mental health assessment or talk to somebody. I also feel like trust is a huge factor as well. So, building up, trust, whether that's from referral from, somebody that a confidant or what have you, or, you've heard other people say that this particular counselor is good or what have you. So I, just want to put that out there in terms of how we get to, that securing the emotional safety to move forward with going to meet with a counselor or therapist. So any other things we want to share as it relates to that briefly?
And a lot of therapists have free consultations or free trial consultations. Vet that individual, make sure that you have a good relatability, you can relate to them, because that is the key to building rapport. Can we relate? And relating is not about always shared experiences, about can you understand the perspective in which I'm at, and can you help me get to a different perspective? So I definitely tell individuals to look for therapists and clinicians that have free consultations, that can, they can maybe test out a couple of therapists, because you don't want to feel like you're locked into one person, or that if you don't have a good experience, that you're just giving up on it altogether. We definitely have to try, and it's a vetting process.
I'm so glad you mentioned that, because I didn't even know that existed. So it's great. And hopefully you all heard that, especially the ladies, because it is What Women Want Wednesday. Ask for a free consultation, or if that's something that they provide, because like you said, it is a vetting process. You want there to be a level of comfortability, and you don't want to feel locked in. So there's a free consult. You can, shop around, if you will, and go with the one that you feel most comfortable with. So I like that you mentioned that.
Yeah, get over that fear factor. And I think, just to make that phone call, people realize that, you know, think about it, pray about it, meditate, and whatever it takes. I know it takes a lot of courage to make that phone call. We all know that. And
Mhm.
so just know my brother, he likes saying the saying that with risk and courage, you can redefine the possibilities in your life. And
Mm.
so just remember that with risk and courage, you can redefine the possibilities in your life. And it's okay to ask for help, and don't be afraid. There's help out there,
Yeah,
and you are not alone. There's so many
absolutely.
people. You are definitely not alone.
So Janita had a question for you all, and I feel like this is a whole nother show right here, but she wants to know, who does a therapist talk to when they need help? And how do you separate your sessions from your life and not allow it to weigh on your heart or mind?
That's
So,
an excellent question. You want to start, Javasha?
so brief, because I want us to wrap it up. But that's a whole show right there.
It is. And very briefly, I think a lot of therapists actually have their own clinicians that they go to, and their own therapists, and they have positive outlets. So the things that we're telling our clients to practice, we're also practicing in terms of positive self-care and positive outlets. And then, obviously we're going to always take that to heart, because that's part of the profession that we're in. But we separate that. That's a professional obligation. If we get too emotionally attached and invested, then we're doing our client a disservice. So we definitely have to separate that and compartmentalize, but it's a part of who we are. It's why we're in this profession, is because we care. And so it's not that it's something that misses us and we don't understand the gravity of it. We appreciate someone being vulnerable to share that. And we definitely use that to affect change. But we have to compartmentalize it so that we don't allow our own personal influences to impact the work that we do.
Great
Yeah.
answer.
And I would just say one of the things, and of course, this is another show, but as counselors, we practice being congruent in walking the talk, and we do practice self-care. I know that I'm practice self-care probably almost 7 days a week. I go to a personal trainer 3 times a week. I walk about 25, 30 miles a week. And there's things that we need to maintain our equanimity and maintain our balance. And
Mhm.
also, we do seek out, a lot of therapists have friends that are therapists. So we're always like talking to therapists. And another show we could talk about, and I know Nicole knows I'm always trying to get people to come back to school. So we'll talk about this another time. But as a doctoral student, there's 5 levels of clinical supervision that we're under as a microscope as a doctoral student. So once you get your PhD, there's 5 levels of supervision. There's group supervision, individual supervision, supervision of the supervision of you and your clients. And it's just, so their degree ends up being counselor education and supervision, because you've had thousands of hours of like supervision to actually talk about your feelings and everything. And so
Mhm.
we're trained to have a certain disposition and demeanor, and be able to be totally with someone where they are, but also be separate. And so again, I graduated in 1999 with my master's degree and my PhD at 2005. And so you just build a way to maintain your equanimity and have a balance and be very calm and be congruent and walk the talk. And as Javasha said, practicing self-care is
Mhm.
very important. So we practice what we preach. And so there's a way to have that professional distance and be there with you, but then go home. And there's a book you might want to read by Dr. Kotler. Jeff Kotler talked about, I'll have to give you the name of it, but he talks
Okay.
about on becoming a counselor. And he talks about how you can take things home with you. So you really have to have some type of other people to bounce it off of, and peer supervision, and safe places where we can talk so we can process and let go. So that's an excellent question.
Okay, good deal. All right. Well, thank you both for addressing that question. I thought it was a great question as well. So, as we wrap up, please let the folks know how they can connect with you. So, we'll start with you, Dr. Mitchell.
If you would like to connect with me, please either go to Psychology Today, or you can email me at dr.mitcham, that's Dr.MITCHAM, at gmail.com. Dr.Mitcham@gmail.com. If you forget that, you can go to Psychology Today and look under my name, or Courageous Conversations, that's the name of my practice, and reach out.
All right, very good. I'm actually putting the email in the comments. All right. And Ms. Jovasha?
Yes, you can also research and find my practice on Psychology Today, or you can Google Lane Counseling and Consulting Group. Our webpage will come up with emails, information, and telephone information to reach us.
Okay, so I'm going to put Lane Counseling and Consulting. All right. Well, this has been phenomenal. I really appreciate you both being on here. I think the viewers really did get something from this. They were very interactive with their comments and questions. Felicia just asked just now, is the book called On Being a Therapist?
Yes. Yes, that's an excellent book. And also I wanted to tell you, I had to put a plug in. I'm so sorry. Shameless plug for Florida A&M. If anybody is interested in being a therapist, we have a program that's totally aligned with the Department of Health program, for the credentials and everything to become licensed in the state of Florida. So please, if you want to email me at my Florida A&M email, it's michelle.mitcham@famu.edu. And I would love for you to be in our program if you would like to be a graduate student and become a clinical mental health therapist or a school counselor. Please reach out.
Okay, wonderful, wonderful, wonderful. I definitely appreciate you both. Before we go, I definitely want to mention to folks that Man Up Monday and What Women Want Wednesday are every Monday and Wednesday at 10 p.m. So I invite you to participate. I thank you for those who were on here tonight. I also want to invite folks to subscribe to the Conversations with Nicole YouTube channel. Subscribing is supporting, and we need all the support we can get. And some of the other things that I have coming up: Single in the City, Where Kings Meet Queens. We're scheduled to do a broadcast, myself, Joketra Horn, and Nicholas Rains next week. And then I also have a virtual meet and greet with current City Commissioner Elaine Bryant next week as well. So lots going on in the world of Conversations with Nicole and Nicole Everett. So stay tuned, stay tuned. Again, ladies, thank you so much. Thank you so much. You have very important work, and I appreciate you. Look, so this is past both of their bedtime, y'all. So
Yeah.
I appreciate them for staying up with us tonight. So kudos to you. Okay, so Gian said Dr. Mitcham gave an awesome insight on how to approach my research from my PhD. Love her. So Gian is currently in the PhD program at FAMU. So
and also, please, we always have, because of this topic, I added a mental health matters section to Tallahassee Woman Magazine. So
that's right.
Always a mental health article, at least one in there. And please check out the current one and the next one. We always have mental health articles. Jovasha, if you ever want to write an article for the magazine, please reach out.
We'll talk. I would love to.
Okay, great.
Good.
Thanks for connecting us.
I like that. Okay, good. All right. Thank you again. We're going to say good night. So
Good night.
Bye.
Thank you.